A very warm welcome on behalf of RESPIRE, the NIHR Global Respiratory Health Unit, to this interactive discussion with Professor Zafar Mirza on working with and influencing policy making with a particular focus on lower middle income country context. So as I was saying, Zafar is a long-term friend and colleague who's had a lot of experience working with the WHO, the World Health Organization, both in Geneva and in the Eastern Mediterranean region office in Cairo. He's been particularly working there around health system development. More recently, Zafar has been a special advisor to the Prime Minister of Pakistan on issues to do with national health considerations. Also led the national COVID effort for Pakistan, so I'm sure that will come up in the conversation as well. He's currently leading the drive towards universal health coverage through a number of roles in Pakistan, including an academic role at the Shifa University based in Islamabad. Zafar, you're very, very welcome. Absolutely delighted to have you here. The plan is that what we will do is we're going to try and make this as interactive as possible. So I'm going to ask you a few questions just to kick off with, and then what I'll do is I'll open it up to colleagues who are joining us both online and in person. So maybe just to begin with, Zafar, it would be just very helpful from your perspectives and experiences, just to give us an overview of the policy-making process, if you don't mind.
Thank you very much, Aziz, and thank you very much, all of you, for your time and for your putting this on your priority list to be here. And hello, everybody online. Well, this question seems to be very simple, but the answer is not very simple. Policy making is a complex process. And I think that if one thing that we can do in this conversation today is to actually go into and establish the various layers and the complexities involved in policy making, rather than as a simplistic young researcher who thinks that once that I have completed the research, now it is up to the world to take it up and run with it and implement it and change the world. Mm-hmm. So from that simple understanding to the real world in which so many dynamics are moving sometimes at cross purposes with each other and multiple layers, I'll try to explain a little bit, not just only from theoretical perspective, because people can read now a lot about, and you people know more than me as more accomplished academics. But from I'll try to bring some real life perspective to it. So first and foremost, I think it is very important to understand that what we mean by policy, the word policy. And then only we can talk about policy making process. One of the best definitions that I have come across of policy, and when first time I learned about it in a book by Jill Walt, who wrote many years ago about health policy process and power. It was a famous book in the 90s from London School of Hygiene and Tropical Medicine. And there was one sentence in this about policies while she's explaining, and she said that policy is something which help us avoid becoming hostage of events. And I think one take a pause to understand this. It helps us to avoid becoming hostage of events. Which means that you can preempt your actions when some situation is there, or a problem to resolve or suggest a solution, and you don't allow yourself just to become hostage of events, but you can be proactive about it by setting up certain policy components. So with this kind of understanding, I think, again, I would say that it should not be thought as a very linear, rational process in terms of policy making. And whereas, we have also now very technical approaches to political mapping and whatnot, Michael Rishworth, and all that is very helpful. But still, I feel that it does not go into the real dynamics of policy making, because I think that for that we need to understand the human nature and the human decision-making processes. What motivates human beings to decide something or not to decide something, or decide against something. And I think the political economy of policy making is more important to understand sometimes than the policies themselves. And what do I really mean by political economy of policy making is the politics around it and the incentives that people see for themselves. And when I say people, I mean there's a long list of possible stakeholders, starting with political leaders, and senior and mid-level bureaucrats, public health experts or technical experts, as we call them, and donors and media. I consider these five most important influencers in health policy making. And various combinations come into play for various kinds of policies, depending upon various interests involved at any given time. But I think the most important thing here still is incentives. When a policy proposition comes on the table or advocated, then what political leaders see in that proposition for themselves, how it make them more credible, more prominent, and what political advantage they can get from this vis-a-vis their bosses, prime ministers and presidents and donor community, and their own future prospects, and in whatever space they see for themselves in future, whether it is within the health policy arena or in political arena. Then I think it's also the bureaucrats and how they see incentives for themselves, which is basically how they can please their political bosses, and how they can actually also see their own progression and administration, how they can also take advantage and benefit themselves from it. Then middle-level bureaucrats are very, very important, and I consider them as this is the largest group involved in ultimately developing policy into black and white, giving different contours to it, developing technical details for this. And this is the most resistant and least understood group in our bureaucracies. And they are the people basically whose job is to maintain status quo. Because any change is endanger their incentives in so many different ways. And we often neglect that. We think that once political masters have agreed, senior bureaucrats have decided, now everything will be happening. But sometimes, actually many times, especially in weak governance environments, where accountability and transparency are not very established. This is the group where it actually stops. And we often are misdirected in our criticism, only limiting it to politicians and senior bureaucrats. And I think it would be very useful to bring a real life example here. So when I took as a special advisor to Prime Minister, one of the early findings that I came up with was the organization that I have in the form of Ministry of Health, and how this organization can serve as a support mechanism for whatever I will do during my stint as a minister. And I realized that the building in which we used to sit in the Ministry of Health had about a staff of about 345 people. And when you try to understand about the technical know-how and the technical background in health of these 345 people, I actually got a very quick survey done, and we could only find 11 people out of 345 who had any kind of health background. So all of the rest of them were civil servants. Some of them were there in the Ministry of Health for zillion years, and some of them were posted, and they are now working for a next posting in another ministry. So those who are mid to high level people, they keep moving in our system, and they represent the tip. But the iceberg is that mid-level and low-level bureaucrats who are status quo maintainers, and they most of them have no background in health. So 11 out of 345, and that's what I sort of was stuck with. And in next cabinet meeting, I went to the Prime Minister and I had a minute with him, and I explained to him that since one of the manifesto agendas were to actually restructure the government, so here is something to be restructured, and I can give you the numbers. So it's 11 people out of 345 who have, and so what do you expect from? So he was quite shocked. I mean, it is common knowledge of the overall situation in our ministries, but when you attach numbers with them, it becomes more, powerful. So he said, yes, we have to change this. Of course, we have to change this. So I said, okay, let's change this. So he had another advisor on restructuring of federal government. His sole job was to restructure. So he said, you team up with him. We make Ministry of Health as a model ministry, and we change it. So I said, great. So over next couple of weeks, number of meetings, number of discussions, number of analyses, and we eventually came up with a new organogram for the Federal Ministry of Health. In which we tried to put, in our innocence. Now, when I look back, in our innocence, we tried to put, technocrats rather than bureaucrats in important positions, and it made so much sense, and it was very rational. And meanwhile, I kept reminding the Prime Minister about this, and this figure he knew by heart. And he used to mention this in very various high-level meetings. Oh, Zafar, first he would ask me, you tell me, what was that figure? I said, 11 out of 345. Oh, yes, 11 out of 345. So 11 out of 345 became, a buzzword for him to be used for changing the ministry structure and function. So we came up with a new organogram eventually for the ministry, and we got this also put on the agenda for the cabinet meeting. So I was asked to present this new organogram. I presented this organogram. And everybody thought that this is a very good idea, and this will provide a lead for other ministries also. So we thought that everybody will live happily thereafter, and it will change everything. To date, and it has been now 2+ years that I left government, almost 3 years. After approval of the federal cabinet under the chair of Prime Minister, that organogram we have not been able to implement at all. No, actually, things have deteriorated since then. And why? I will explain that. First of all, this was very threatening move for people who were sitting in the ministry. It endangered them, because for civil servants, losing any position, any allocated position in a system is considered as a very, very negative thing. And it is as if they're losing ground in terms of power dynamics in the system. And it was more of a problem of these middle level and low level civil servants than the top level, because it was more easy to make them understand. But then they will also be moving, to the next ministry very soon. But that iceberg, which is immersed in this system, they were so resistant to it. And all kinds of criticism started, and all kinds of gossip and all kinds of personal attacks started. And to cut a long story short, and we were not able to do that. And later on, when we thought about it in the hindsight, it was basically, we never realized that what are the interests which are embedded and how deep they are. And sometimes not with very material benefits even, but it is just the power dynamics that and people do not allow you to enter in their space, if you like. So this is just one example where you see a problem, you pick up that problem, you analyze that problem, you package and present that problem to the authorities. You get the policy decision, and yet you are not able to implement it. And this is just one, example. There are so many other examples that I can give you, even from my own experience. But so I think it is very important that we understand the system much more and much more deeply than we think that we understand it. So that's number one. The second thing is that we also need to understand that given all this what I have just described, still there can be windows of opportunities. Still there can be some political expediencies of the political leaders, which if you understand timely, you can still make few changes. And again, I think bringing some one real life example, and then I'll get back to you. So I knew, for example, that there was one good bureaucrat who had a good experience of working in health in the province, and I thought that he will be very useful. So I wanted to get him on board. And he was considered as opponent of the government, because in previous government, he was holding a very important position. And since then, he was made OSD. OSD is Officer on Special Duty, which means no duty. So basically, so officer of special duty means that you can put that person in an empty box and enjoy doing nothing. So, so to bring those such OSDs out of those, empty spaces and put them to some, useful work, it is very difficult, especially if they are considered as politically not suitable for political leaders. So I had an opportunity just to, with one day with Prime Minister to explain this, that he can be very useful for all the plans that we have. But, he was working with as his principal secretary to the previous Prime Minister. So that's why he has been sidelined. So if you allow, we can bring him in. So he said that, and I told him that he's considered as a opponent, politically. I mean, he's perceived as a politically belonging to a party. So he said that don't worry about this. We'll manage this. And can we arrange a meeting with him? And I said, yes, we can do that. So a private meeting was held, and he thought, yes, he's actually very good. And we brought him. And this was the beginning of the COVID. And I had a brilliant bureaucrat with me who was considered as otherwise not very suitable at that time. But I could explain this to him, and he was convinced, and he took the, because there was a lot of opposition to that decision, but we could do that. So such windows of opportunities also keep appearing. So, and the timing is everything there. How well you can seize that window of opportunity, and if everything helps you, you can make the right decisions. So I think I'll stop here. You can go on and on policy and its problems.
Great, thanks very much, Zafar. That's absolutely fascinating. I do have other questions, but I mean, let's just bring others in though. So Hilary, I don't know if you can unmute. Let's give that a go. And just if you want to ask your question.
Hi, that was fascinating and really, and makes so much sense. But my question, of course, was the very practical one. Okay, so that's where the block is, or a block is. How do we, and you may not have a simple answer to this, but how do we get to that block? As researchers, with something we feel we want to change, how do we get to this? I think you referred to them as civil servants, whose job it was to maintain the status quo. Give me some practical hints.
So the question is really, so it's basically this iceberg. So these civil servants who are interested in maintaining the status quo. What I mean, how to deal with them, how to put them on side.
Yeah, I think they need to be factored in to start with in every in any decision that you make. And I think again, policy being a very political process, I think it is very important. Actually, on this point, I have to mention that in many other languages, the word policy, its equivalent is actually politics. So in Arabic, the policy is translated as siyasiya, which means politics. So there is no actual exact translation of the word policy in many languages. It is actually considered as politics. So. And I think the answer to that is that we simply do not ignore them. And whichever policy we are trying to advocate for or push, it can be anything. I think what is very important is that we recognize the role that they will play. We acknowledge them and also build in their incentives. And this sentence should not be misunderstood. I'm not talking about bribing them, frankly, but at least, think consciously about what incentives they will have in terms of their involvement, in terms of their acknowledgement, in terms of their, giving them prominence, and massaging their ego, frankly. It's important, it's human. And also build in some, for example, if you're thinking about a research project or thinking about a program that you want to introduce, and knowing that they are very important force, how we can also, involve them into travels or meetings or, exposures and things like these. Small things, but they should be feel involved. I think it is very important, and the starting point of that can be building, informing them properly. And from there, I think the whole idea of respecting them as important stakeholders. Because the power dynamics dictates that you only look in policy making upwards. You don't look downwards, usually. Whoever we are and whatever our position is, we usually look upwards. We seldom look downwards. Because we think that our incentives, and it is very interesting, our own incentives are defined by the decisions who will make above us. So we forget in that process, there are people who are below and who look up to us for those decisions which will affect them. And I think that's very subtle point. It's very important point. So I think it's a common knowledge. Everybody understands this, that the process of policy making is as important as the product, as a final document of the policy. The process through which you reach to that product is equally important, and sometimes more important, because it determines the fate of the product. And I think in that process, we need to factor in this immersed iceberg also in public sector organizations, and how we can involve them in. Because two things I have considered very important in public policies. One is the process, as I just talked about it, and second is legitimacy. From where you are drawing this legitimacy. And with legitimacy comes ownership. And legitimacy is nurtured. It is part of the process, but it is, I'm also defining it separately because it is so important. So if, for example, everybody around the table say that, yes, it is very important, this is a very important legitimacy they're assigning to what you're trying to do. But if you don't start the right process, then it is another way of actually inviting opposition. So not doing the right things, meaning that you are inviting the negative influences, which will hamper the way. So these subtleties, I think, are very, very important. So I think that even if these are generalists, civil servants, low to mid-level people, I think they still have common sense. And we need to involve them in making them understand that what we are trying to do here and how it will benefit them, their families, their children, their people at large. So it may still, what I have said until now, it may still not appease them, or it still may not be satisfying. But at least we should try to do that and try to build in incentives in the largest sense of the word, into whatever.
Great. So I know there's a couple of other questions online, but let me just see if there's anybody who wants to raise anything in the room. First of all, Julie, yeah.
Listening to you speak. I'm thinking about that the mid-level bureaucrat, because whether you're talking about government or you're talking about government agency, or you're speaking about other types of organizations, that entrenchment at mid-level, I think, happens in all organizations. You see that in all organizations, that need to justify their own existence, preserve the status quo. So when you say that we need to understand what they value and what would incent them to evolve, I struggle because sometimes that feels like appeasement of the mid-level, whoever we're talking about, mid-level bureaucrat will say, we're appeasing them, which is expensive, time-consuming. What are some other ways of diffusing that mindset, helping them recognize the value in doing things differently, doing things better?
Partly, I think I responded to this in my last response. I think that the sincerity of effort, and not just seeing them as people who are there only to maintain status quo, and hence you have to deal with them in a rather forceful way. I think what is important is to recognize them, and as I said, acknowledge them as important stakeholders in the process is critically important. And I think these things permeate, even if they don't bring immediate material benefits to the people, but simple acknowledgement and recognition helps a lot.
So I guess what I'm hearing, Zafar, is that, I mean, for us as the academic community, it's about, but often we're trying to develop and nurture relationships with senior figures, which is important. But what I'm hearing sort of loud and clear is that's insufficient. I mean, what we need to be doing is working across the layers of government, really, if we're going to kind of try and influence change. Okay, thank you for that. Felicity, do you want to come in next, please?
Thank you. Really interesting and insightful. Thank you for what you've said so far. I had a question around public and patient involvement, and the question was around the prevalence of this obstruction from middle bureaucrats across all spheres. And I, as I'm a clinician as well, work in the NHS. Experts can say things powerfully with evidence, but change doesn't happen. One complaint or concern from a patient changes things sometimes more rapidly, but often the public don't know enough to challenge and hold decision makers to account. So what are your thoughts on how we best equip the public to hold decision makers accountable and make them deliver without scaremongering and recognizing that they all have busy lives?
Yes, thank you very much for asking this. And I think that there are two answers to what you have just said. First is that I think, first of all, you need to understand that are you dealing with a policy proposition which is being pushed or which is being pulled? And I think this is very important to recognize this also. If it is being pulled, this means that somebody has an interest in this, and that interest needs to be understood in its detail. Whether it is some senior bureaucrat or it's head of the state, or whether it is health minister or whoever. So if you understand that, then you have to align support from the public to that interest once you have analyzed that interest, because then that alignment will work very well, in the longer run. Sometimes the mistake that we make is that since now the health minister is saying this, or since prime minister is saying this, you don't need to work with people and the civil society. And that's a mistake, because ministers and prime ministers come and go. issues stay there and people stay there with their problems. So that kind of alignment will only ensure the sustainability of whatever you are trying to introduce. So that's number one. So if the case is that there is no pull, but you have to push it. So there, obviously, it is basically putting issues on the political agenda. And then you have to analyze that how this can happen, how the groundswell of public opinion will push that agenda upwards. So obviously, civil society organizations, people, interest groups of various kinds relevant to that issue need to be taken on board, and that will only make your case more powerful, and it will be basically trying to convince the decision makers by pushing an agenda and rallying your allies around it. So that's my sort of simple, without being simplistic, as we say, explanation for this. But one thing which I will also further add to this is, I think also very important, is to understand the emotive part of your appeal. Without being melodramatic, and without being, becoming too emotional about it, I think it is very important to give a human face or human angle to the tragedy, which you are going to address through a certain policy proposition. And in that process, you need to understand not only people who are suffering from it, but also the personal experiences of decision makers and their likes and dislikes and their own life experiences. Sometimes simply understanding something of that sort helps you tremendously in getting a policy made and implemented, and then years of research and developing an evidence to prove that how important it is. In Pakistan, maybe that is not a great example, but still it is. Our largest cancer hospital is made in Pakistan through public donations, and it provides free cancer treatment to those who cannot afford as good a treatment as people can get anywhere, actually, in the world. And it was built by our former Prime Minister. And why he decided to build that hospital was because his mother developed breast cancer. And she passed away because of that breast cancer. And in the last couple of months, he was on her bedside, and he saw that what kind of problems and what kind of miseries people go through. He was very influential person, fairly rich, who could do everything which was possible by Pakistan for the treatment of her mother. But in that process, and he has said it many times, discussions, speeches, that he, during that process, realized that if I am so influential and if I have so much leverage in the system, and I have so many problems, what will be happening to people who bring their mothers and loved ones, from far-flung rural areas, come to cities, do not understand the terminology of cancer and its natural history and treatment, and cannot afford it. So that was the paradigm shift for him. So this is I give this an example just to make a point that personal experiences sometimes, if understood correctly, in a particular policy that you are trying to develop is sometimes can be tremendously helpful.
Great, thanks so much for the question, Felicity, and for the very helpful response. So I'm going to try and take, we've only got about 15 minutes left, so I'll try and take a couple of questions together, if that's all right. You're probably quite used to this model, but Hannah, do you want to go first, and then we'll go to Gail?
Thank you so much, Prof. Aziz, and Assalamu alaikum, Dr. Zafar. It's so nice to see you here. My name is Dr. Hannah from Nuventive Solutions, Pakistan. I'm Director of Programs here. And I must say that your presence is immensely being missed here in the ministry in Pakistan. Having said that, my question revolves around your comment on the process of policy making. So, and that I would like to kind of have an understanding about the initiation process of policy, because here in Pakistan, obviously, you know, policy initiation happens either because of some donor funded mandate or a political party bringing in its mandate. So can we have a process of a regular review of policies, because policies tend to get shelved? We have excellent policies which have been developed on a large number of issues, but they tend to get shelved, and there is not a regular review on those policies. And you know, they don't tend to get reviewed and revised and updated because there's a lot of evidence coming in on a regular basis. So I was just thinking that keeping the donor mandate and the political mandate aside, can't we have a process of a regular review and updated process of revision of these policies? If you could tell us your take on that.
Okay, all right, let's just hold that.
I'll begin with this question.
Yeah.
Thank you for asking.
Brilliant.
And coming from former colleague from Ministry of Health, you know,
Yeah,
that's
brilliant. Okay, Gail, do you want to ask your question?
Yeah, thank you both. Gail Carson-Istrick, Oxford. Yeah, so Dr. Mirza, I'm aware of your role at EMRO as well as your position at MOH, and I do quite a lot of work with WHOs. I'm sure many of us do. Just intrigued to hear what your thoughts are regarding the pandemic treaty and the position that that's in at the moment on the run-up to the WHO this year. And if you were Dr. Tedros, based on all the wonderful experience you've got, what would you do to make sure that that it goes through? Thank you.
Okay, Gail, great question. So first one from Hannah, policy kind of initiation process and review.
Yeah.
And the second is, what should your mate Tedros do? Yeah.
Thank you, Hannah. Thank you. I'm very thrilled that you asked this question from the position that you are in the organization. That augurs so well for the future. You know, if people like yourself, thinking people, are thinking this way. I would have made this point toward the end of this conversation in any case, and that is as follows. It will partly answer your question, but it will go beyond that. Actually, what happens is that policy making process is a abstract construct in our organizations. Whereas we are very methodical, technical about our different programs and different strategies, we have left policy making process as to the whims of people, and as if something it is natural to happen and it will happen. There's no. In other words, what I'm saying is that what is needed is, as Hannah was saying, institutionalization of policy making process. And that does not exist. And I have seen even in very advanced organizations, that does not exist. But what I mean by institutionalization, exactly what Hannah alluded to. So you develop, you identify a problem, whoever is pushing it or pulling it, but you identify a problem, you develop a policy, you have stakeholder consultations, you analyze, you provide best evidence, and ultimately you have a document. For many people, this just stopped there. And at best, what discussion takes place after that is now we need to implement it. Actually, it's a loop, and we have to consider policies in an analogy of loop I use, that you implement policy and then you see the impact and then you make people accountable. You be transparent about it. Failure, successes is a different thing, but what are the learnings and how those learnings are looping back into the policy adjustment. And here, what mistake we also make is generally is that we consider policies as a static phenomenon. Whereas in today's world, policy is actually a very dynamic thing. The evidence changes, the objective conditions change, leadership change, the allocations change, and the situation on ground change for which you develop that policy. So thinking about policies in 3 years time frame and 5-year time frame is important, but not enough. There must be a flexibility and there must be a dynamic approach built into this, that you can continue to do that. Now, institutionalization also means that you assign very clear responsibilities to different levels of people working in ministries of health and in hospitals and in different health-related organizations. And there is a regular review of how those policies are performing, how those are being implemented, if they are being implemented well, fair enough. If they are not, then what adjustments need to be made. And with that also, of course, come accountability. But all this must be a deliberative process. It must be a cautious process, which requires time, which requires responsibilities, which require effort, which require resources. And we do not pay enough attention to all this. And unless we do this, it will never be institutionalized, and it will remain as a very abstract construct, policy making and policy development and its implementation. So answer to Hannah, to you, is that I think we need to promote this whole way of policy development and ensuring that these policies, are pursued and reviewed properly. And that, we need to develop norms for this. Linked with this is also another very important point, which is linked with this community who are sitting here, who are researchers, who are academics. We are also more interested in developing policies rather than actually doing research that why those policies do not get implemented, if you know what I mean. We are more interested in technical aspects of the policies rather than equally, if not more, also taking responsibility or putting this on your agenda, that how these policies should be institutionalized, all what we have discussed, what are the incentives, who are the decision makers, windows of opportunity, stakeholder analysis, consultation, etc., etc., etc. And start developing some norms, some protocols, some algorithms, and some, standard operating procedures for policies, their development, and their implementation. And this requires research. This itself requires research. But this research is seen as superfluous, not important enough. Donors don't pay for it. Public organizations don't pay attention to it. And I think that this I see as a very glaring gap. From research community side also. What we know is from social sciences perspective, some qualitative research, this and that. And that is most of it is analytical. What I'm talking about is taking it to the next level and developing similarly those kind of algorithms and standard operating procedures for policy development and implementation as we develop clinical algorithms and as we develop, clinical pathways for ensuring that interventions work. Likewise, I think this area needs to be addressed. And I think it is very important, and I hope that RESPIRE or whoever projects, research projects, health research projects will also factor that in and give its due space in your budgets, in your responsibilities, and in developing expertise about it. And the last point I was asked about this pandemic treaty. To be honest with you, I have not followed it very closely. But I know also that we have, it will be a good thing to do. And there is a lot of push and pull there. I know what I read from different, commentaries on the process. I think that it needs to be done. But I also have realized one thing, Gail, that international treaties come later. International, global health and its role is very, very important. But it all starts from home. What we do first in our own environments. We were just talking about, we are just coming out of, in the larger sense of timing, we are just coming out of a global experience of dealing with a pandemic. And every country suffered from it. How many countries have set up the processes for which you don't need global, for which you don't need Dr. Tedros? You just need to develop your national processes of learning from generating good, bad, or ugly, whatever response you generated for dealing with global pandemic, and recording those learnings and feeding those learnings into development of future emergency preparedness and response. For this, you don't need treaty. The problem is that we don't do what we are supposed to do, and we keep, putting a lot of discussion and a lot of discourse and a lot of effort into global instruments. I'm not saying, and I don't want to be misunderstood that it is not important. It's extremely important because we are all in the same space here, the whole globe. But it cannot be either or. We have to start from, and then if we have done what we were supposed to do in our own countries, our ask and our demand from global health will be much more meaningful and weighty, and it will attract much more seriousness from global health and global institutions. Sorry, maybe it is divergence from your question, but I had to say this, that we are not doing our job in most of our countries. Thank you.
Okay, I think we're at time. So I know there are a few other questions. Zafar, is it all right for colleagues to contact you directly? I mean, if they've
of course
questions, yeah. So Felicity, maybe you'll take up Zafar on that front, and but can I just Zafar say just an enormous thank you, really. I mean, for sparing the time for the kind of openness.
If you allow me, I have to make one more point.
Okay, sure.
I'll be very quick. Sorry for interrupting you, but I had noted this point, and I had, observed this point in my experience so many times, and I think it is so determining for the fate of policies, and that is how we deal with conflict of interest in policy making. It is so pervasive, it is so unattended, and it is so powerful. that sometimes we, it's like being blind to the elephant in the room sometimes, and then moaning about the policies and their weaknesses in terms of their implementation and impact. I have seen people making public policies for tobacco taxation who own cigarette manufacturing plants. I have seen parliamentarians who have their deep interests in running their medical colleges involved in making regulations for medical colleges. So the conflict of interest must also be a big ticket item in this whole conversation about public policy making, who makes them, and it is absolutely very important. And we are not saying that conflict of interest is natural. We all, at some level, have different interests in the same thing. But to be transparent about it and to manage that, and there are ways to manage that. I think this one big issue has negatively influenced many good public policies in many low and middle income countries. And I would not be surprised that it is also very prevalent in high income. And it is, I know how the lobbyists work and how, all that whole area, the corporate interest, the profession's interest, different lobbies. And we need to be very clear about it, that for good public policy making, for public good, require as an essential requirement the identification and management of conflict of interest, and this should not be left unattended.
No, I'm really pleased that you've underscored that. And Dom, I think maybe one of the actions that we need to do is a workshop on conflicts of interest. I mean, in a RESPIRE context, really, I think that would be incredibly helpful, not only for the academics, but inviting sort of our partners along in that. So, Zafar, thanks so much. Absolutely fantastic to have you here. I mean, so useful to get your insights. Thank you, everybody, for joining. And finally, can I just also thank Kitty and Dom, really, for pulling all of this together. Thank you so much.
Thank you so much.
Thank you, colleagues, for joining online. We're going to stop there, but thanks so much. See you soon.